All right. So dealing with, I think the first question that people come up with is, and I've had somebody mention that two people actually mentioned that this question came up, dealing with constructive criticism. Now, we have been trained, or we think at least we know everything, right? And we practice, we study hard, and we think we're the best or we're the cream of the crop for the whatever country we're from, right? But we're always learning. And because we have big egos, so we end up at times, let me do the presenter view. Okay. Speaker view. All right. So at times we feel that we are the best there is, the best there was, the best there ever will be, right? And we can't make any mistakes, right? But that's not the case. We're constantly learning. And it may seem a little awkward if somebody is giving us criticism. So normally the question is about constructive criticism, but however, most of the time, in real life, you don't have real constructive criticism. The person may criticize you in a backhanded manner, right? But let's talk about constructive criticism, and we'll end with how you will deal with a backhanded criticism where somebody has not been that nice when they give you some feedback, right? Okay, so hey, doc, what will you do if you made a mistake, any type of mistake, and your attending comes and talks to you, or your senior resident comes along and talks to you and give you some feedback? How would you actually go around handling this? And have you done this in the past? How have you dealt with constructive criticism in the past? Okay, now the candidate. Well, good question. And I do see that I've learned actually that constructive criticism is actually a valuable opportunity for my own growth. And I have learned that I need to actively seek criticism to improve my own skills. And I do remember during one of my internal medicine rotations, I did receive feedback from my attending that my patient presentation skills needed to have a bit more structure to it. Initially, since I was just new to the ward, I was a little bit taken aback, but I quickly realized that this is valuable and feedback is valuable to me. I asked for specific examples and a bit of tips from my attending on how I could improve. And I implemented these suggestions. And in my next presentation, I was much more confident and I was able to handle more complex cases in a much more organized manner. So I do welcome constructive criticism. And this is what has helped me. And I do feel that in a stressful environment, as on a medical floor or a surgical floor or a psych ward or a busy family practice clinic, uh, I do feel that you may not always get constructive criticism, and a senior or even a colleague may not be that kind or be thoughtful enough to give real constructive criticism, and they may end up being a little rude. But in a medical setting, you have to realize that, hey, it's all about patient care. It's all about being a better physician. And even if somebody has been not the best in their approach, I feel that I would think for 2 seconds that, hey, okay, is this advice or is this feedback that this person is providing me, is that actually useful, or it is just malignant? If it is, definitely useful, I would, suck it up and I would realize that, okay, yeah, thank you. I realized that was a mistake I could work on. So whether it's constructive criticism or much more straightforward criticism that is probably more to the point, I think I've learned to, take it nicely and look to improve myself, because, I'm at the stage that I need all the feedback that I can get. Thank you. All right. How was that? Reasonable? Maybe? Yes, no, maybe so?
Yes, I think that was great.
Okay, all right. So that was, I think, an example of internal medicine, but you can do anything.